What is physical therapy, and why should a myeloma patient consider it?
Hi, my name's Beth Travis, and I'm a physical therapist. Physical therapy is a discipline that falls under the category of rehabilitation medicine. The basic goal of physical therapy is to improve the patient's ability to move, reduce pain, restore function, and prevent disability. And I think it should be part of every myeloma patient's journey.
What does a physical therapist do?
And what we do is we help individuals develop, maintain, and restore maximum body movement and physical function. So, what that means is we want to be there for you after you've had an injury or a disease to help you recover, relieve your pain, and prevent further injury. Or perhaps in the case of multiple myeloma, deal with a chronic condition. You can get physical therapy at any age or stage of your life. And typically, the tools we would use in physical therapy would include exercise, hands-on care, modalities, and patient education.
Why would a myeloma patient consider physical therapy?
I'd say most important for a myeloma patient is we use physical therapy to improve the quality of your life. We want to improve your function, reduce your pain, and make sure that you don't become disabled by maintaining your fitness level.
What is an individualized assessment?
An individualized assessment is especially important in myeloma patients because of the lesions that occur. Every myeloma patient's different. So what we like to do in physical therapy is first listen and find out about your myeloma journey. And then we want to incorporate additional information like your lab tests and your imaging, get an extensive past medical history, and then we want to put you through an initial evaluation where we look at your physical function, things like range of motion, strength, sensation, coordination. And then we want to combine that with further assessment, looking at your functional ability. Can you roll around in bed? Can you stand up, walk, run, jump? So those are the type of things that we look at. And when we're done with that, we put it all together and develop a plan of care. In physical therapy, an initial evaluation, you should set aside about an hour of time because it is a lengthy exam. Typically, we like to see our patients for about 4 weeks and then reassess. Now, during those 4 weeks with the treatments, you're going to be coming to physical therapy, but you're also going to be doing a home exercise program. We reevaluate at 4 weeks, and we can reduce the frequency, which can start off with 2 to 3 times a week, but as you get better and more independent in your program, it can be reduced to once or twice a week. And as you move forward, you can also get a reassessment anywhere along the way just to see how you're progressing or if you're having any problems. And a lot of times with myeloma patients, there are individual nuances and we'll need to address them as we go. And we'd like to be there for you.
What is a plan of care?
Typically, a plan of care is developed based on the data that we've collected. So we utilize typically flexibility to get motion, strengthening to get more power. We'll use different forms of strengthening. It could be open chain or closed chain.
Open chain exercises are exercises that are performed where the hand or foot is free to move. Closed chain exercises are physical exercises performed where the hand or foot is fixed.
Sometimes with myeloma patient, closed chain is better than open chain because open chain involves lifting weights, whereas closed chain uses things like squats and push-ups, which at times can be safer for myeloma patients. Then we'll progress to aerobic training because we want to reduce your fatigue by improving your general fitness. We use a lot of modalities in physical therapy: heat, cold, electric water therapy is wonderful, especially for myeloma patients, because what it does is it helps reduce the weight-bearing forces on the body. So it's a great way to get started.
Who benefits from physical therapy?
Just about everybody will benefit from physical therapy. There are a couple of contraindications. For example, if you had a fracture of a long bone or some spinal cord compression, we would probably not treat you for physical therapy at that time or have a more in-depth conversation with your physician. Typically, we have a lot of special concerns with multiple myeloma patients, especially with bony lesions.
How is my spine protected?
Multiple myeloma patients are often at risk for a spinal fracture. So what we want to do is stick with the concept of neutral spine, where we maintain spinal position more in the middle, not forward bent or flexed, or too extended or bent backwards. Those type of positionings during exercise safeguard the spine.
My doctor didn't recommend physical therapy. Does that mean I don't need it?
We hope that your physician likes to include physical therapy, but it's always okay to ask to have it included. It is covered by most insurances, and you really want to incorporate physical therapy as part of your myeloma journey because we want to improve your health and especially improve the quality of your life. So please keep us in mind.
My name is Beth Travis, and I'm a physical therapist, and I want to thank the myeloma crowd for having me today. I do want to talk about physical therapy because I think it's an important part of any myeloma patient's regime. The reason why physical therapy is so important is because it helps develop, maintain, and restore maximum body movement and physical function. And the things that we utilize in physical therapy are hands-on techniques, physical modalities, patient education, and most importantly, exercise. So in order to utilize physical therapy, you would see your local physical therapist, and they would do a formal evaluation, which would include a patient history, an assessment of strength, range of motion, sensation, and physical function. What we do with that information is we generate a plan of care that we talk to your physician about, and then we move forward and monitor your progress. And typically with myeloma patients, we do have to modify the program along the way because we want to relieve pain. And that's really important, so we change the program so it's comfortable for you. It's really important to help patients with illness or injury because we want to help you restore function and maintain your way of life, as well as improving the quality of what's going on in your life. So generally, exercise helps you feel better, helps you move better, and it helps you sleep better. And that's just in a healthy individual, and we'd love to see those components happen in a myeloma patient. I do want to talk specifically about why myeloma patients need an individual assessment, because typically what you see in myeloma is everybody's different. So you really do want to be assessed by your physical therapist because everybody's a little bit different. And we do want to protect you during your exercise program. So a lot of times there are certain contraindications for physical therapy. For example, things like a fracture in a long bone or perhaps spinal cord compression. Those are specific areas where we might avoid certain physical activities. I do want to talk a little tiny bit about safety because typically what we do is we first review your lab results, and then we'll talk to you in detail. Usually a physical exam takes a full hour. And what we do is we isolate the problems that you're having. For example, a lot of myeloma patients do have pain. So what we need to do is figure out ways that we can get you exercising without pain. Sometimes we'll use, for example, a non-weight bearing thing like a bike or a pool to get you started. And then we'll improve your strength or your flexibility depending on your individual problems. Sometimes we can just educate you on how to lift better. We just love to hear about what your problems are so we can orient the therapy towards your specific needs and improve your quality of life.
And you wanted to speak to safety?
I did want to speak about safety. The CDC has a great website that talks about fall prevention, which is absolutely key in myeloma patients. Their assessment includes a review of medications, proper eyeglasses, footwear, a home assessment, and different types of exercises to help with balance, because we'd really rather prevent a fall than have to deal with the after effects of a fall. Those are things that we typically do during a fall assessment, and it's part of the STEADY program, which you can see on the CDC website. And there's a whole variety of different programs. One of my favorites, the Otago program, which is a free program available online that helps with strength, endurance, and balance. But there's other things like Tai Chi, and they're all there on the website. And we use a lot of different techniques, yoga. Getting back to the safety component, we do like to avoid extremes of motion of the spine. For example, too much forward bending, flexion, backwards bending, extension, or extremes of rotation, because those can be damaging. So typically when we generate the program, there are some general guidelines that we do use with myeloma patients, like that, avoiding extremes of motion. A lot of times during a therapy session, we'll focus a lot on neutral spine, proper posture, things like that, because we do want to protect you and make sure that your spine stays as healthy as possible. Oh, right. There are different types of exercise, and typically what I like to use in myeloma patient is closed chain exercises versus open chain exercises. Open chain exercises utilize things like weights. Now with myeloma patients, we can use weights depending on the severity of the bone damage, but closed chain activities, things like squats, step-ups, counter push-ups, regular push-ups, those type of activities where you're using closed chain activities are typically a lot safer, and they can be strenuous as well. We do. We look at all your imaging tests because we want to know where your bone density issues are. But we also look at things like hemoglobin, because we know sometimes your energy level can be low if you have anemia or low hemoglobin. We check oxygen saturation, we'll monitor your pulse, and a lot of times we'll pick up things as we go along, which is why it's important to be monitored and frequently reassessed. I'm sorry. I think probably the most important thing is improving your quality of life, getting rid of the fatigue. At the same time, another safety thing that we do is we do want to avoid excessive fatigue, but physical therapy is going to help get your endurance up so you can participate more in your day. Another thing we monitor, especially with patients on chemotherapy, is your hydration levels. Those are important. So we're going to make you drink during your therapy session. And I just think being able to return to some normal activities, maintain your independence, keep with the walking, keeping up your physical stamina, very important.
You mentioned you like biking and something else.
Well, it depends on the patient and what they like to do. A lot of times patients can have a lot of pain initially, especially newly diagnosed, so we use things that involve less weight bearing, like a bike or a glider. And then we like to progress to walking because bone is a dynamic structure that responds to stress. So it's not like we want to completely avoid stress, but we'd like to put it on gradually in a comfortable manner. Just if your doctor doesn't offer physical therapy, ask for it, because we want to be there for you and we want the quality of your life to stay high and we need you to stay fit.
What if my doctor doesn't recommend physical therapy? Is it covered by insurance? Where can I get physical therapy?
Well, most myeloma doctors are fans of physical therapy, so I don't think you'll have a problem getting a referral for physical therapy, and all insurances